Hello, everyone. Thank you for joining us today. Welcome to our webinar about CHW integration into health systems. Can I go to the next slide, please? So before we begin, this meeting will have simultaneous Spanish interpretation. Your interpreters today will be Julio and Delia. And as a participant, you will need to choose a language, either English or Spanish, to listen for this meeting. If you go on the bottom of your screen, there is going to be an interpretation icon. You could click on that and then select either English or Spanish to listen into. Next slide, please. So closed captioning is also available for this meeting as well. For the folks who are on laptops or either computers, on the bottom of your Zoom screen, you will see a closed captioning button as well. So you could click on that and then select show subtitles. And then for the folks who are on mobile devices, you will have to go into your Zoom meeting settings and then turn on closed captioning. Next slide, please. So welcome, hello and welcome everyone to CHW Integration into Health Systems. My name is Mengshi Kang and I am the Envision CHW Training Coordinator. The Envision team is excited for today and grateful for the opportunity to once again be in community with you all and share this space with each and every one of you. So this month's webinar will shed light on partnership between a CCR 2109 recipient and their local FQHC on CHW integration. And then we will also be presenting some actionable steps for other CCR 2109 recipients and just the audience in general, because we are aware that some folks on here are not CCR 2109 recipients, to also enhance their capacity to implement engagement strategies as well. Next slide, please. So while on call today, we have a small list of operating agreements to ensure that we can collectively build a welcoming and brave space. Much of today's webinar will be content delivery, sorry. So we do ask that you stay on mute and pose questions in the chat box. The chat will function as your primary point of connection today. We encourage you to use it frequently and treat fellow attendees with dignity and respect while doing so. And then a last reminder to do what you need to do to take care of yourself. Okay, so today I will start with sharing some Envision news. After these Envision updates, we will highlight how this webinar is linked to the grant strategies as well, and then dive into our primary content, which will include presentations on our CHW integration. So who is Envision? So Envision is composed of community health workers and community health worker allies who work together with financial and administrative support from the disease for Centers for Disease Control and Prevention to elevate the roles of CHWs in COVID response and recovery. So Envision supports the CDC funded program, CHWs for COVID response and resilient communities, which uses the acronym CCR. Today, and then you can find more details about the initiative and who the funded organizations are at the link in the chat. And then to learn more about Envision and our staff, click on Envision's land page link and then opt into our listserv. So both links are now being put into the chat. Envision news. So we would like to introduce you all to our new council members. So we were able to onboard 5 new council members. And then they are Toki Dunn, Shantany Jackson, Lorena Sanchez, Honey Estrada, and Dantia Hudson. So we do, Honey Yang Estrada is actually helping me co-facilitate this webinar, and I would like to give her this time to introduce herself to everyone. So Honey, if you could please come off of mute and introduce yourself, that would be great.
Thank you, Hongxi. What's up, everybody? It's good to see y'all. Honey Yang Estrada, president of the North Carolina Community Health Workers Association. I'm so very honored to be selected to serve as a council member for the Envision team. This work is so close to my heart, as it is for many of all of you. And just, again, very honored to share this space with you and excited to learn. I always very much appreciate the opportunity to be in spaces with like-minded individuals who are working to advance CHWs. So thank you, and thank you, Hongxi.
Thank you, Honey. If you would also like to learn more about our CHW council members, you could go onto our website to read bios about them and do a little just research on them, because we have great individuals on our council, and it would be great for everyone to visit them and learn a little bit more about who they are. Next up, we do have updates about our webinars for year 3. We will be having evaluation and program implemented webinars for most months now. I know it wasn't like that in the previous year, but starting this year, that will be occurring. So for the month of March, we actually have a CDC special studies webinar. And then there's also a CDC year 3 guidance webinar as well. And then next up, I would like to have Honey introduce us to, not introduce, but also highlight how this webinar is going to be linked to our CCR strategies.
Excellent. Thank you, Hongxi. I think we can go to the next slide. All right, guys. So y'all ready to dig in? Today's presentation, we're going to highlight 3 of our CCR strategies. We have our friends from the Massachusetts Department of Public Health presenting today on strategy CB3, which integrates CHWs into organizations and care teams to support the public health response to COVID-19 among priority populations within communities. Oh, excuse me. Did I? Okay. All right. We also have Kansas Department of Health and Environment, and today they're going to reflect and share strategies on CB4, which is develop and disseminate messaging that educates organizations and care teams on the critical role that CHWs play in delivering services and managing the spread of COVID-19 among priority populations within communities. And both of these teams, both of these presenters have implemented strategy IR4, which integrates CHWs into organizations and care teams to support the public health response to COVID-19 among priority populations within communities. I know that we are here for a good time, and I know that they're going to share a wealth of knowledge with us. Very excited to hear them speak about this. And I am now going to turn it over to my friend Erica.
Thank you, Honey. Hi, everyone. It's such a pleasure to be here again and join all of you from all over the country. My name is Erica Guimarães. I'm also a member of the Envision CHW Council. And so I'm here today for the next, we can go to the next slide. Before we get started with the introductions to the presenters and into the theme of integrating CHWs into health systems, we just wanted to pause a little and share the definition for CHW integration from the CDC pertaining to this grant. So here's a brief definition. So CHW, integration of CHWs means that CHWs are brought into organizations and care teams as active members of the team to contribute to COVID-19 response efforts ideally as equal participants whose role in fulfilling the mission of the organization or care team is understood and valued by colleagues. While the extent of integration may vary, CHWs are integrated into a team if they are performing the C3 roles. So this is the CDC definition. I just want to say a word about, so the C3, for those of you who are not familiar with the Core Consensus, CHW Core Consensus Project, this is a national effort, and there's a link here embedded in the slide, and I'm also going to copy the link to the website into the chat for those of you if you want to take a look. But so the C3 project, as I said, is a national effort, and it defines the comprehensive CHW roles, skills, and qualities. It really has been an effort that helps to establish national consensus on the CHW scope of work and their roles. And it helps to provide guidance for improving CHW practice and policy. So this is a helpful tool, helpful resource for those of you within health systems who are, working to integrate CHWs. So that was just a quick word on the definition of integration. And again, yes, thank you, Sherry, for copying the link into the chat. It's there if you want to take a look. Thank you, and we can go to the next slide. Mongshi, I'm going to turn it over to you.
Thank you, Erica and Hani. So next up, we are going to be looking at the objectives of this presentation. So we're going to be looking at how to approach health systems, right? Where to begin with CHW integration. And so one of our presentation is going to be on sharing one of our CCR 2109's relationship that they built with the FQHC and their partnership for integrating CHWs into healthcare settings. And then next up, we will also be providing steps to CCR 2109's to take and what they could take on to advance CHW integration into healthcare systems. And then also provide examples from a CCR 2109 recipient of communication materials that they could use to also help advance this work. Next slide, please. So with that, it is my pleasure to transition into our primary content for today's meeting. And I want to invite Erica to introduce to you all our first presenters.
Thank you, Mongshi. So I'm actually joining from Massachusetts, and it's a pleasure to introduce the presenters from Massachusetts because I've known them for a long time. They've been leaders in the CHW efforts here in Massachusetts, and I'm so delighted that they're here to share their knowledge and expertise. So for this next part of the webinar, we are going to hear from Shariva Delgado. So she's a community health worker, technical assistance coordinator for the Department of Public Health within the Office of Community Health Workers. We'll also hear from Natalie Bazil. She provides also CHW here in Massachusetts and provides technical training and technical assistance for the CCR grantees here in Massachusetts. And Linda Barrows, also longtime leader here in Massachusetts, and she's the director of the Office of Community Health Workers at the Massachusetts Department of Public Health. So welcome all of you, and we're looking forward to learning from you. We'll turn it over to you all.
Can we go to the next slide, please?
Good afternoon. Good afternoon, Linda Barrows. Thank you so much, Erica Guimarães, for the wonderful introduction. And I'm speaking from a snowy day in Massachusetts, Department of Public Health, and glad to be here with you for the next few minutes and sharing with you what we've been doing in the state of Massachusetts. Next slide, please. Thank you. We are here together because we know that the integration of CHWs into healthcare systems is important. And this webinar, this presentation will provide insights from the Massachusetts Department of Public Health on how we have supported a local community health center, among others, to successfully integrate their CHW into their healthcare systems within their facilities, and also to hear about a testimony from a community health worker from a different location, a community health center, just sharing how integrated she feels into her own healthcare system at her facility. Next slide, please. Thank you. Everything starts with some history, and we would like to share with you where we started and where we are heading to. So just to start in the last 20 plus years, during the first 10 years of the year 2000, a group of active CHWs rallied around the need to have proper representation that would advocate for CHW's needs and growth in the future. That is when the Massachusetts Association of Community Health Workers, or MACHWA, was created. And it is a statewide CHW network led by CHWs. MACHWA continues to be alive and well and going strong to this day. Shortly after its creation, MACHWA surveyed CHWs and CHW supervisors to see what trainings they would need to be better prepared to make a difference in their communities. The need for a tailored curriculum was raised then. Also, a CHW-based best practices was established for the Department of Public Health-based vendors through contract policy. In 2009, the Office of Community Health Workers was established in response to recommendations by the statewide CHW Advisory Council created by the State of Massachusetts 2006 health reform. Now moving on to the following 10 years, in 2010, an act establishing a board of certification of community health workers was signed into law, and that is the venue that CHWs apply for state certification. Training centers apply to become state certified institutions to provide approved trainings, among other things. In 2012, marked the CHW training and curriculum development, which was and is an investment in CHW core training. For the following 2 years, CHWs and CHW partners came together to build consensus on core competencies. And in 2014, precisely on May 13th, 2014, the first CHW core competency was revised and approved by the Board of Certifications. So a lot has happened and even more to come. But for now, next I will pass it on to Shariva Delgado to move on to the next level. Thank you.
Thank you, Linda. The Massachusetts Office of Community Health Workers supports integration and workforce development of CHWs. This slide demonstrates who we are. We work on CHW workforce policy, CHW certification. We provide technical assistance for integration of community health workers. We work with the Massachusetts Associations of Community Health Workers, and we work together with different organizations. We strive to elevate and expand the work and capacity building of statewide CHW workforce and increase the number of certified CHWs. We also collaborate with state and nationwide initiative and testing of CHW toolkit to evaluate the efficiency of the CHW work in different settings. Next slide, please. Here are some ways that the Office of Community Health Workers strongly encourage health centers to integrate CHWs into the health system. For example, number one, by having EHR access and training, CHWs can have a better understanding of patients' diagnosis. They will be able to meet patients where they're at and provide proper resources in a timely manner. Two, integrating CHW into primary care team. It is empowering to collaborate with providers and bring patients social determinants of health need and coordinate services and or referrals. Three, having communication with other departments such as behavioral health to discuss patients' need or desire, brainstorm about services that could be offered and schedule or reschedule appointments. This is crucial to patients' care and coordination. Four, part of CHW role is to engage patients deeper into their own care. CHW should have necessary permission to look at reports to determine appointments needed and an easy way to understand whether a patient is overdue for a follow-up. And lastly, CHW should have authority to schedule appointments. Examples of these appointments can be primary care, urgent care, or any other appointments necessary to coordinate patients' care and transportation as needed. Next slide, please, and I will pass it on to Natalie Bazell. Thank you.
Thank you, Shariva. Now let's focus on the community health centers that currently work with the COVID-19 response and resilience communities. These community health centers serve a multicultural population within their communities. These community health centers are serving people with a larger rate of COVID-19. These communities are stratified by race, ethnicity, income, language, culture, or other social demographic characteristics. The communities that the health centers serve have higher chronic conditions, limited access to healthcare system navigation capabilities, and have the highest social determinants of health rate. CHWs can help bridge gaps between the healthcare organization and the community and help in delivering appropriate care and service to their community. Keep in mind that CHWs are trusted members and have special knowledge of the communities they serve, put them in a unique situation to empower and mobilize these communities. Next slide, please. The MA CCR 2019 goal is to place more trained CHWs in communities that have been hit hardest by COVID-19 and among population at higher risk for COVID-19 exposure, infection, and illness. The goals are to train, engage, deploy, and integrate CHWs. CHWs funded by this grant are expected to be involved in trainings throughout the course of this grant and beyond. DPH Office of Community Health Worker maintain a list of training for CHWs, including core competency training, special health topics, and training for those who supervise CHWs. In addition, CHW supervisors should develop a training plan with each CHW to ensure continued learning. When it comes to engagement, how we engage them, CHW has helped build and strengthen community resilience to alleviate the impact of COVID-19 by improving the overall health of their communities. Some of the CHWs can be engaged by summarizing, but not all that is included in this list. Some ways are outreach, doing outreach activities, screenings, making referrals, and successfully connecting to various health centers and social services. Deploy. TA have connected with CHWs at local board of health to identify resources and gaps and work to strengthen culturally appropriate resources and service wherever possible. The TA have also provided peer-to-peer support learning by sharing workflow that is working. We encourage, when it comes to integration, we encourage supervisors to fully integrate CHW into the healthcare system. Shariva and I did a good job sharing how CHW can be integrated into these communities in the previous slide, as well as Linda with some of the history and the role that the the Office of Community Health Worker has been doing. Furthermore, both TAs have visited all 10 health centers to meet with CHW and learn all the amazing work they are doing in each health centers. In addition, the EPI team worked with all grantees to reframe the questions, the evaluation question, to capture the true work. Now, we understand numbers is important, but we want to make sure that it is actually being captured to report what is being done. These are some additional ways our office has integrated CHW into the community, into the health centers, to make them feel heard and continue to empower them as they serve their communities. Next slide, please. Now, we want to thank you for your time. Here are some resources that we want to share and highlight with you all. We have the CHW Inclusion Checklist, Community Health Worker CHW Toolkit. We have MATRA, the Massachusetts Community Health Worker link, and we have approved training and educational program, CHW and MA Improving Healthcare Public Health. Next slide, please. We would like to share a recording from Edith Mercy, a CHW from Laurel Community Health Center, who is fully integrated into their healthcare system. Please play.
Okay, thank you, Massachusetts. Hopefully we could resolve that that issue. But next up, we will be hearing from Curing Health Center, so an FQHC's perspective on CHW integration. So representing Curing Health Center is Joanna Lopez, the Director of Social Care and Community Health Workers Initiative, Cherise Burston, Community Health Worker Coordinator of Social and Community Health Workers Initiative, and then Kiara Omo, a Community Health Worker at Curing Health Center.
Thank you, Hamshid, and hi everyone. Thank you for joining today's webinar on CHW integration into the health system. Next slide, please. So during today's presentation, we will walk you through the integration of CHW in a federally qualified health center. We will be sharing a bit about Caring Health Center as an organization, the history of how we developed the CHW program, and what the CHW program looks like today. Next slide, please. So a little bit of the background, you can go to the next slide. Thank you. So Caring Health Center is a Section 330 federally qualified community health center located in Springfield, Massachusetts, which is a federally designed refugee resettlement area. We were founded in 1995. We have a board of directors that is 51% consumer-led, and our president and CEO is Tanya Barber. We offer a range of services and primarily serve those with low income, immigrants, refugees, and racial ethnic minority groups. Our services, the services we provide it to all patients regardless of their ability to pay. Next slide, please. This slide gives you a snapshot of our patient population and the comprehensive care we offer. As I previously mentioned, CHC serves as a uniquely diverse community of low-income patients in a medically underserved area. We are the only FQHC in the city of Springfield, and our services are provided in over 30 languages. Caring Health Center provides primary care, oral health, behavioral health, substance use prevention, nutrition. We offer WIC. We also have a pharmacy, and other wellness and preventive care for both adults and children. As you can see here, we serve approximately 20,000 patients a year, where 47% are best served in a language other than English, and patients face several social determinants of health barriers. Next slide, please. Now let's talk about the history of CHW integration at the Caring Health Center. Next slide. Beginning in July 2015, Caring Health Center worked towards integrating at that time 7 linguistically and culturally diverse community health workers into primary care teams through 2 funding streams. As we know, community health workers, they provide clinical community linkages to eliminate barriers to care and social services. Currently, Caring Health Center has established a team of 12 plus community health workers across multiple departments. All of our CHWs are enrolled and complete the CHW core competency course, like Linda mentioned, here in the state of Massachusetts. And once they complete the course, we provide our CHWs the support they need to become certified community health workers here in Massachusetts. Our CHW workforce has similar roles as they screen patients for social health related triggers or needs, and they also assist patients to access the services they need. The team also provides culturally appropriate health education, information, and outreach in community-based settings, such as homes, schools, shelters, and local businesses. Next slide. We have a wellness center where we provide a range of services that are currently supported by the Massachusetts Department of Public Health Cardiovascular Disease Grant and other funding streams. Our wellness center has 5 guiding principles, which are culturally tailored, meaningful programs to be delivered, led by trained and certified leaders with capacity building opportunities to develop wellness leaders. It is cost-free. We have group-based and programs that provide to the community and our patients the support they need, located within primary care setting. And the 5 guiding principles were identified by the community and patients through a qualitative interviews that was conducted when the wellness was established. Next slide, please. Here is our wellness center pre-pandemic. Most programs right now are currently being offered virtually. However, we hope to be able to have this amazing experience that we had in the past pre-pandemic with our patients doing programs face-to-face, doing exercise and cooking classes. Right now, our wellness center has been transformed when the pandemic hit as our COVID response screening. So the wellness center, as you can see, is a large space that right now patients are screened, employees are screened for COVID. They're seen if they have COVID symptoms. They're still being seen in our wellness center, which has been transformed from a wellness teaching space to a COVID mitigation area where we can serve our patients who don't feel well and may have COVID symptoms. Next slide. Here as is a snapshot of the programs currently offered and led by community health workers. I will not go into detail to all of this, but as you can see, we have a variety of diverse programs that are being offered to our patients. And also, there are free costs to our patients. We also connect patients with community programs like the YMCA, and we provide them with resources such as bus passes and grocery gift cards as part of the programs that we offer to our patients. Next slide, please. So how the CHW program looks like today. So I'm gonna show you in the next slide a picture of how our community health workers being integrated into our clinical teams. So here you see a snapshot of how integrated our CHWs are in our clinical groups. If you recall, when I shared the history of CHWs previously, I mentioned that Caring Health Center in 2015 worked towards integrating 7 CHWs. Now we have, like I mentioned, over 12 community health workers and community health workers like role. This is an amazing achievement for our health center, and we would not be able to do this without the support of our funders. The CHW assignment into clinical teams, as you can see here, is based on provider coverage. What that means, for example, if you look at the first three rows in the sheet, you're going to see that they're in colors. So each color is a group of provider teams. So our providers are team up. So when a provider takes time off, another provider covers their in-basket messaging or any patient inquiry. By assigning a CHW to each team, the provider in each team will have the same CHW as their main point of contact. You can see the various roles of community health workers, such as our medical CHWs. You see our behavioral health community health workers. You see our recovery coaches, COVID response CHW, telehealth community health worker, and refugee case managers. This team assignment provides the opportunity for our clinical teams to reach out to a CHW who is an expert in a specific area. And I'm going to show you, I'm going to provide you with a visual pretty shortly of how that look like. Here, I also want to highlight how we have a diverse and multi-language community health worker workforce. The bottom, you can see the languages that our team speaks. So we have a team that includes 5 races, ethnicities, and 6 languages. Next slide, please. Here are other community health worker responsibilities taking place in addition to the ones that I previously shared. But I want to highlight, for example, registries. We utilize registries and patients list to identify patients who are in need of COVID vaccination. And those who are due for their social screenings within the same list, they also get screened and linked to social resources, such as COVID mitigation, supplies, food, and digital devices for telehealth services. Next slide, please. So this is the visual that I mentioned that I wanted to share with you guys in terms of how we integrate our community health workers in clinical team. So in this slide, I want you to see how we integrate CHW into a patient care journey. If a patient needs a new doctor, we have our generalist community health worker who can assist with this. However, any and all of our CHWs can connect a patient with primary care service if they need to. Another example is a mother with a child who wants to protect her family from COVID, but also needs assistance in finding childcare. This is where our CCR and community health worker funded through this grant jumps in to help the family to connect with vaccination or any resources they need and connect them to those resources. Lastly, you can see at the end of the road, we see a provider who identifies the need for a patient with chronic conditions to receive support. This is where our ACO CHWs and complex care team are integrated to provide ongoing support. I really enjoy this visual because you can see how in a road of a patient in so many areas, we have a CHW that can provide support to our patients, whether it's a behavioral health, someone who feels sad and alone and needs help, to someone who is like in a rush. If you see the guy with a backpack, I don't have time to come into the health center, but I do need to see my doctor. And then we have a CHW who can help him to connect to a telehealth visit. Next slide, please. So here I'm going to pass it to our CCR community health worker, Kiara Olmo, so she can share a little bit about her experience being integrated into the clinical teams and also the work that she does with our amazing team in the community in our mobile unit. Kiara?
Hello, everyone. Can you hear me? Can anyone? Okay. I just want to make sure. So hello, my name is Kiara Omo. I have been working at Caring Health Center for about 7 months now. And since then, I have learned a lot about the importance of being a CHW within the healthcare community. I have also been able to collaborate with other departments to continue engaging in patient care for out-of-care patients and also scheduling patients who are due for another dose for their COVID-19 vaccination. And we are currently working on other and many more collaborations with other departments to better improve patient care. We have been able to bring care to the community through our mobile unit, which you can see in the image. Using this, we have been able to go to low-income communities to have vaccination opportunities. And along with that, we have been given food and gas gift cards, which typically range from $50 to $75. And during that time, we are able to assist patients with any resources that they may need outside of vaccination opportunities. Yeah. And then I think I'm passing it to Sharice.
Thank you, Kiara. Next slide. So hi, everyone. My name is Sharice Burston, and I am the coordinator of social care and CHW initiatives at Caring Health Center. Today, I will be discussing how we support our team as CHW supervisors. So the areas of support that we provide are role development, professional development, one-on-one support, team building, and active support towards routine workflows. Now, when it comes to our team building, we have bi-weekly and monthly check-ins. This gives us an opportunity to discuss any administrative announcements, program operations, and workflow reviews. It also gives us a good opportunity to brainstorm together with any solutions around case reviews and just encompassing a big team-based approach to situations. We really enjoy motivational interviewing, so we really hone in on those skills during these meetings. The next form of support are our one-on-one CHW supervision. So in this, we take a deep dive on what's working well, what's not working so well, assessing current successes and challenges, and performance and questions about the caseload and how we can better support our community health workers. And finally, our CHW referral assignment. So this is a report that we pull from our EPIC work queue. Within this, I review and assign the referrals to the designated community health worker. I provide special instructions and guidance under the comment sections that's pertinent for the CHW during the navigation and outreach that they'll be doing. This is followed up with an in-basket to the CHWs, informing them of the referral and just emphasizing that, hey, please contact this person within 72 hours because we really want to provide that needed support in an efficient time. I want to thank you and have a good day. Next slide.
Here is our contact information. So everybody is welcome to email us if you have any questions or have further discussion and would like to connect with us. Here is our contact info. Thank you, everyone.
Thank you, Caring Health Center. So Monique, can I have you allow Natalie the ability to share her screen? Because she would like to share the audio from the previous slide.
Hello, my name is Edith Mercy Wambo-Njuguna. I'm a community health worker at Lower Community Health Center. As we all know, a community health worker's responsibility is mainly to bridge in the gap between the community and the resources. We're not born or we just don't wake up with the knowledge. Since we too are humans, we belong in the community as well. What makes us who we are is just being keen to listen, understand, and be willing to help. and learn. COVID pandemic was disastrous to all of us. It almost brought all of us to our knees and the realization that life is precious. We all have a lot of healing to do. My role as a community health coordinator brings me to interact with patients through calls. Many instances, I'd be at the receiving end of hurt and ailing people, and all I have to do is to meet them with empathy, contempt with compassion, cruelty with kindness, and ignorance with knowledge, as this is the only way I know how best to heal our community. My goal has been to help our patients back into receiving care in person, and most importantly, advocate for their prevention measures against cancer through colorectal cancer screenings, mammograms, pap smears, with an extension of COVID vaccination awareness and management of hypertension and diabetes, with the help, of course, of a great team and team players as well. Lower Community Health Center is dedicated to the well-being of our patients and the community at large. Allow me to mention a few challenges of this kind of engagement with the community. We live at a time of scam calls, right? These calls make it difficult to win the trusts of people and to have a conversation going on. But I have so far managed over 600 calls and had most success in many of them. Every call is different, just as we have different people and personalities in the communities. It takes some preparations and research to understand the patient before the call to ease in the conversation. Time is of essence, of course, and I have learned never to rush patients, but also to be alert and respect their time. These are hard times we are living in. Many are depressed and going through a lot all around. At times, I call it wrong timings and get negative reactions. It can be very painful. Some may insult, others hang up, but my response in this always matter. I listen, I wait. I calmly express concern, and mostly the success stories are born. It may take a second call or even a third. Patience is key. Colon cancer in particular in this is one of the top 5 killing cancers in America. So with great passion to bring this giant down and engage with patients due for screenings. For some, it needs conviction as to why they need it. To others, it's simply a follow-up from doctor's referral. For many, it's the assistance of receiving care and connection to the facilities that do so. From the point of getting a referral to the final stage of screening, the process takes time. Time sometimes never works in our favor, and patients may end up losing track and failing to pull through. As a community health worker, I ensure that patients get the awareness they need, support they need, understanding of the process, remind them and make appointments that they need to get to the screening phase. I have encountered patients with multiple needs. Sometimes screening as a prevention measure is the least of their worries. For example, I had a patient who was due for screening and pending some blood works. As usual, we never know what to expect before a call. A frail but hopeful voice responded. A mother, a grandmother fully consumed by the things that take over the minds of many women to care for others before themselves. She communicated why she knowingly just ignored her health to care for her family. She was not going to give up to let her health issues come in her way to love and be present. Her grandchildren were around at the time. Could it wait? She humbly asked. As a community health worker, I want to be able to match the community and the clinic, bring the patients back to receiving health care. But it is until we get to understand what is important to the hearts of people, so shall we succeed. I was able to listen and focus on a painful broken toe, as she said about it, that needed medical attention, as well as have her come in for the screenings one at a time. We successfully got into an agreement of the way forward and planned her visits. It took more than one call, a trusted relationship. I have called the homeless and many undergoing difficult life issues with many challenges, including food, shelter, and in need of medication refills. The calls have been a lifeline of such patients. But because of time, let me just mention a different kind of patient that I had. This patient was a working class person, but with challenges as well. Her health was calling to inform her of the screenings that she was due.
many, in fact, almost all the screenings and tests under my care gap. This only meant that her health wasn't good. It was heartbreaking to hear her own story, yet someone could judge her. Healthcare is expensive. She did not qualify for free insurance, yet she had just gotten a new job that couldn't cover her. Her insurance couldn't cover her at the time until the end of the year. Could her health be put on hold? Could her deteriorating health wait? She, like many mothers, was overly concerned about her daughters and even keeping up her job. She had a growing cyst, her leg was hurting, her blood pressure was going high, her list of issues were endless. I pushed her insurance need forward, but yet to have success. My success in this is she had someone, even for a few minutes, to listen, to hear her without judgment. The world is empty if one thinks of only mountains, rivers, and cities, but to know that someone is there and thinks, feels with us, and who, though distant, is close to us in spirit. This makes the earth for us an inhabited garden. One thing I love about working at Lowell Community Health Center is the community of great, wonderful people dedicated to serve the community. Their inclusivity, diversity, community engagements, hiring the community health workers to bridge the gap, appreciating health workers, employing me, and allowing me to continue engaging the patients with full support from the clinical team, as well as give the relevant trainings. This, of course, has been made much easier from the support we get from CRC Grant and the DPH. Thank you all for listening.
Thank you for bearing with us. We really wanted to highlight and share Edith Mercy's story, who is a fully integrated community health worker in the Lowell Community Health Center. Thank you all for your patience.
Thank you, Natalie, for making that work for us. I know there was a few struggle with making that audio work. Can I go to the next slide, please? Oh, next slide. So thank you, Kering Health Center and Massachusetts Department of Health for that presentation. So now we would like to transition to our next presenters, who is Jackie Cantrin, the Senior Director in Community Health Worker section, and Juliet Swedlund, the Program Manager in the Community Health Worker section from the Kansas Department of Health and Environment. Next slide, please.
Thank you. Okay, hopefully our video will play. So the first part of our presentation is a video that we developed after some information from our clinics asked for a video to show providers and other people they were working with the benefits of community health workers.
You can hear it?
Yes,
okay.
We can hear it, Monique.
Community health workers promote health access to everyone according to their needs. By being familiar with the culture and beliefs of the community they serve, they keep community members informed with health knowledge and self-sufficiency topics. They help the community by removing barriers to eliminate health differences, increase access to resources, and help bridge healthcare and the health of the public as a whole. This builds healthy communities.
I love my job. It's very fulfilling. I have one of the most fulfilling jobs in the world. And it can be extremely hard, it can be extremely taxing, but at the end of the day, knowing that we are expanding the infrastructure of public health and we're saving everybody money, we're improving the overall community, we're decreasing property crime, we're doing all these amazing things by really just focusing on the basics. Transportation, housing, childcare, healthy food. I feel like we can change the world just by expanding those resources. We need more people doing it.
Whenever I first started with community health workers, I kind of had I wasn't quite sure what to expect. But now that I've gotten in the swing of it, I definitely can't live without them. I'm spoiled. They're an extension of me, and I couldn't be more appreciative for their work. I think that it is a position that is, you don't know you need it until you have it. And then now that I've had it, I don't think I would ever take a position where I don't have it.
When you think of clinics and hospitals and whether or not they should be using CHWs, one of the things that are very important is to consider that community health workers, they can go beyond the four walls of the hospital or the clinic. They are an extension service that goes in the community, reaches out to the clients, to the families, and then they bring those outcomes back to the providers, to the medical staff.
Being a community health worker is more than just here. It is helping you at your home and helping you on your day-to-day life. And, you know, some people just don't have the means to structure or to even, you know, I say budget because I'm not very good at budgeting, but, you know, they may need help in those situations. And then just knowing that they have that community health worker that they can reach out to while they're even at home and it's not even a scheduled visit to guide them through certain spots of their lives.
I think that CHWs are suited in regards to bringing all these things together because we are of the community. We are out here advocating, we're out here getting information from the community. We're asking, what is it that you need in order for us to know what we need to provide and what we need to ask for our local and state and sometimes federal governments, right?
So one thing I think it's really important that on a broad spectrum we know about community health workers that go beyond the standard community health worker work is that we are talking about human capital investment, not just in the community health worker themselves and in the community they're serving, but in the entire population and subset of healthcare in our system in America. When we are supporting community health worker efforts, we're supporting a stronger network of health overall, we're supporting a stronger community overall, and we're supporting capacity building in the individuals that each community health worker touches, each family of each community health worker, and all the systems that they're navigating and working. Because we're seeing that you do not have to have magic letters behind your name to make an impact. We're seeing that you do not have to have multiple degrees or medical backgrounds to make an impact in community. You need to have some good solid training, good understanding of what health is, and be able to do the work in a way that's best for your community. And that's not going to be the same for every community, but what's best for your community. And who knows that best than the people who are living in the community every single day.
If I had the opportunity to talk to another nurse about starting a CHW program within her facility, I would tell her, go for it. You have to do this. This is going to be your lifesaver because we are limited as humans. And most nurses, our hearts are huge. We just want to give, we want to give love, we want to give care, we want to give support. But there's a limit to what we can do. Even for providers, there's a limit to what they can do. They would love, I'm sure, to sit at the bedside all day, but they can't. As nurses, we would love to sit at the bedside all day, but we can't. And so the CHW really helps to facilitate those extra things that we cannot do.
You know, there's no I in team. And the doctors learn that. The providers, they've figured that out. They know what us CHWs do, and they know that we are their hands and ears out there and eyes, and they love it. They just really appreciate having somebody out there that can be the outstretched arm and the umbrella for our patients and for them.
Okay, thank you, Monique, for sharing that and problem solving it. So like I said, that video came out of just a need from our sites of what they were wanting. We are integrated into 14 different sites, and we found that some of them know what community health workers are, and some of them read the description for the grant really were interested, but not everyone there knows kind of what a community health worker does. So that video was developed because of that. Can you go back to the slides, Monique?
Monique, you have to go on to the slides because you're in the different one. Yeah, okay, there it is.
Here we go. Okay. Another thing we worked on developing was a brochure. So again, this is for our clinics wanting to give to their providers as well as having out front for their patients. So we developed this to kind of explain the benefits of adding the community health worker to your team. And they can, on the back, they can write the community health worker can write their name, their contact information, and hand it out to patients that they're working with. Next slide. Another one pager we developed was just having the benefits again of community health worker to give out to different organizations, CBOs, clinics, hospitals when we were discussing integrating into their organization. So this was developed at the beginning of the grant, and a lot of our new partners still find that really useful. These are the only ones that we have on here, but in the Envision, shared a link of several resources that we have available. And again, there's just different things that our clinics ask for, we come up with. So right now, we are actually currently working on another video, and this video will highlight the Healthy Heart Ambassador class that is CHW led, and the success from one of our clinics with leading this class, the benefits the patients are having, interviews from patients, that relationship building aspect from the CHW, lessons learned and how to make that class successful. We also have a motivational interviewing open practice that we hold monthly for CHWs to get on and join. They can work through, they can bring a specific situation that they might have or anything that they would like to bring just to really work on that motivational interviewing. We also offer peer support groups for CHWs so they can get on and support each other. That's monthly. And then program manager monthly peer-to-peer support. So all of our program managers in the clinics that oversee the CHWs can kind of ask each other questions and learn from each other of what worked for them, what didn't work for them, what resources are maybe available in their area. And then Juliet, do you have anything you want to share? We don't have very much time, so I don't want to go over our time limit.
No, Jackie, I thought you did a wonderful job.
Okay. So if there's any questions on any of the resources that Envision gives out, I think our emails are also attached. You guys can always email us any questions on that. And I think that's our last slide.
Sorry, I was talking, but I didn't unmute myself. So thank you for Jackie and Juliet. And they were able to share us a lot of information too. So Kansas was able to provide us additional materials. So the link is, so the materials and the resources they provided for us is actually on the Envision website, which is being dropped right now. And if you want to go and take a look at those additional resources that they provide for us, is going to be under resources on our in our website. So you could go ahead and take a look on there. And then next up, I will pass the mic on to Monique to give us updates on the communities of practice.
Hello, everyone. I just want to take a moment to talk about our communities of practice at Envision. We have 3 coming up, and we would like to invite all of you to come and participate, give your input, have your peer-to-peer learning. especially the CHW integration into health systems, will be a continuation of this webinar. So please come and share your resources, share what you're doing in your areas, maybe what you would like to do in your area. And, you know, it may be someone doing, you know, what you want to do in your area. So just sharing those ideas, those thoughts, resources, and just making sure we are keeping this work going and supporting each other in the work. We also have a Spanish speaking community of practice. So there, that in that space, you will not need an interpreter. It will be conducted in Spanish. So please join us if you are a Spanish speaker. If you work, your CHWs are Spanish speakers, please come and join us at our Spanish speaking community of practice. That will be the first one. So it's a meet and greet. Come and share topics that you would like to discuss, pressing issues that are coming up. And we can discuss those and have that peer-to-peer learning and those sharing moments and breakout rooms and how we can support each other. And then also we have an all-tribe gathering for those in the tribal areas or that work with those tribes. And you can come there, and we're looking to even establish an all-tribe gathering in person. So we're working on that going forward and how we can meet in person and truly support each other's work. So we have the all-tribe will be March 8th. Our Spanish-speaking community of practice will be March 16th. And then the CHW integration into healthcare systems will be a 4-part series. So that will start in March and then go through June. So the links for registration will be dropped in the chat. And please, please come join us. We welcome all input and just continuing our conversations and supporting each other's work.
Thank you, Monique, for the updates. Can we go to the next slide, please? So next up, we do have, so for the month of March, the CDC is hosting a call for the CCR 2109 and the CCR 2110 recipients. And they're hosting 2 sessions on the same day. So it's going to be on March 2nd. So one session is at 3 p.m. Eastern time, and then the second session is at 7 p.m. Eastern time. So CDC would like the recipients to register for either session that works best for you all. The sessions and the registration links will be put into the chat right now. And then second, we have a CCR 2109 Year 2 Performance Measure webinar on March 8th as well. So that registration link is going to be put down in the chat. So we do invite you all to join us for the webinar to kind of learn or get updates from the evaluation team on what has been going on for year 2 of the of our grant here at Envision. Okay, next slide, please. So thank you. I want to thank the presenters and and my co-facilitators one more time for helping me make this webinar possible. I do want to let everyone know that materials and resources will be sent out in a follow-up email. And then we will be, these webinars, both the Spanish and the English webinar are being recorded, and it will be posted on AMP, our Envision website, and YouTube as well. But before anything, I do want to launch our poll because, your feedback is very important to us and helps us tailor this time, together to best support your work. So please take a moment to fill that out. And then after polls, we are going to have a quick Q&A session as well. Oh, the Q&A. Did the Q&A slide not appear? Sorry about that. We're having technical issues here, but so we do have a good 10 minutes for Q&A. So for the folks who have any additional questions, I know that questions were being asked in the chat and some of it were answered as well. But then there was a particular question that was not answered yet. And it was this, it was, I am wondering about the process to integrate CHWs into CBOs that do not currently access community health worker services, but whose client could benefit.
Marcy, do you mind repeating the question again? I didn't
Yes.
capture it. Thank
I
you.
I could also paste it on copy and paste it on there as well, but I could repeat it one more time. So it is, I am wondering about the process to integrate CHWs into community-based organizations that do not currently access CHW services, but whose client could benefit.
But if they don't have access directly to CHWs, how would they be able to integrate it in their work? So they will probably mostly have a memorandum of understanding with their local healthcare provider that actually have community health workers and create a working partnership, I would say.
Does anyone else want to add in as well?
This is Joanna Wangshi. I think I would add also, we have had organizations in the community that, for example, we had a housing organization that they don't have community health workers. So their caseworkers is just focusing on getting applications for housing. One of the things that we identified was conversating and having a conversation with the leaders on that organization. We said, okay, your case managers, they do just the application process. Do they have the capacity or have experienced any other challenges with the community members that they're working with that have challenges on other areas outside of just the housing situation? Some of them have shared, yes. Some of the community members have mentioned medical. They don't have a doctor. They don't have a dentist. So that's when at times I have jumped in and said, hey, we have community health workers who can assist with connecting your members in the community that your case managers cannot address with medical and services that we provide. So sometimes it's kind of like a bargain approach. So sometimes I said, this is something that you can help us with, and this is how our community health workers can help your organization and the patients that you're serving, because many of them were serving the same members in the community. So sometimes that's that approach that I have utilized in the past on how integrating community health workers to collaborate with community-based organizations.
And I would add, when I worked very closely with community-based organizations, we had internal partnerships where the CHW teams or a couple of CHWs would go, let's say once a week, every 2 weeks or so, and spend time in the area that they needed and just do assessments. They were available. If it's housing, for example, people would come to them with, as Johanna said, with their additional concerns. And then those were referrals that the CHWs would in turn work on it and connect, whether they were tenants or attendants of that community-based organization, into completing their unmet needs successfully that way.
Thank you for those recommendations. Does anyone else have anything to share as well or add on to this question? So I know that Marcia and Essie, you all were keeping track of some of the questions. But are there any folks on this call at the moment that has a particular question you would like to ask? You could come off of mute and ask it or raise your hand as well.
For the ones that who may not be very familiar with MOUs, the Memorandum of Understanding, I would definitely urge them to have the conversation with their supervisors or managers. And if they do outreach, they have identified different partners in the community or stakeholders in the community that would like to have access to the CHW work for referral purposes. They would start with that, because that way legally there's some information sharing that they could agree to have done.
You, Linda. Were there any questions from the chat previously that weren't addressed yet, Marcia and Essie?
I believe all of them were answered via chat, and the one that I sent you was the one that was not answered.
Okay, sounds good.
Yep, same. Thanks for asking.
Mm-hmm.
And if there's other questions that people may think afterwards, maybe they can reach out to Envision and pose those questions, and you can send it to us, and all of us will try to answer in the best way possible.
Yes, Linda, thank you so much for that. I don't see any additional questions or anyone with their hands up. So I would like to take this time to thank everyone, as in the presenters, the facilitators, and the participants for joining us today. There were a lot of great questions being asked and a lot of great content being shared at the same time. And I enjoy seeing this interaction with the participants and with the presenters and facilitators as well. So I do want to thank each and every one of you for joining us today. And I hope to see you all more in the future in our webinars. So I will let you all go. Luckily, we ended 7 minutes early. So please, take this time and hopefully get a little 7-minute break for whatever you have coming up next. So thank you, everyone.
Thank you.
Yeah, thank you.